I am pleased to announce that new federal funding will be used to expand lab and testing capacity across the state of Maine. This week, we received $52.7 million in federal funding from the U.S. Centers for Disease Control and Prevention to respond to infectious diseases, particularly COVID-19. This funding is being provided through the existing program that supports epidemiology and laboratory capacity for infectious diseases. Governor Mills outlined 3 primary goals for the $52.7 million. First is expanding the state's lab capacity. The state is aiming to expand both in the short term and long term the capacity at the state's Health and Environmental Testing Laboratory called HEDL. This includes expanding physical space and increasing staffing to accelerate the number of testing options it has. In the long term, the state intends to accelerate the construction of its new lab in Augusta, which broke ground prior to COVID-19. Investing in a state-of-the-art lab will facilitate COVID-19 response, innovation, and public health generally in Maine. Second, we will bolster rural hospital lab capacity. COVID-19 has underscored the long-standing challenges that rural residents in Maine face in accessing timely health care. Building on the Mills administration's initiative in rural health transformation, the Maine CDC will work with rural hospitals to expand lab capacity to help them respond to COVID-19 and other infectious diseases. And third, we will support additional drive-through testing sites in the state. As the state lab ramps up its testing capacity, the state of Maine also aims to increase the number of testing sites outside of healthcare office settings. Currently, Maine has 38 testing sites outside of office settings. The state is exploring partnering with businesses and others to establish new so-called drive-through swab and send sites in Maine. This would allow primary care providers to recommend patients get testing in sites that are both safe and accessible. As Governor Mills said, this work is in the initial stages and will take time over the coming weeks and months, but it would not be possible without the partnership of the congressional delegation. This funding was included in the Paycheck Protection Program and Health Care Enhancement Act, and these new initiatives build on recent announcement by the Mills administration to significantly expand its testing capacity in partnership with IDEXX. This has allowed for the elimination of testing prioritization system so that healthcare providers can recommend testing for anyone they suspect of having COVID-19. As announced earlier this week, clinicians may now order tests for symptomatic people and people without symptoms who are at risk for transmitting COVID-19 to others. We're very excited about this new funding.